together about these different findings. Dr. Utz, do you want to start the discussion?
Yes, and first of all, big thank you for sharing your cases with us and for these nice presentations. And I think everyone who's listening at home can recognize his own patients in these complex cases. And first of all, one interesting thing that Barbara and I just discussed in the chat, there seems to be a role for patients who have a weak perception of their own body, such as patients with Asperger's or autism spectrum disorders. And I would like to give this question to the physio team members. Do you think there's a role for Simeox in helping these patients who can not really feel well inside their body structures and functions?
Hi, Claire. So I think from a physio point of view, I do think that it helps the patients understand their own breathing pattern more. So now, as part of my practice, I start AD breathing and different breathing techniques earlier in clinic settings and outpatient settings, preparing them for Simeox. And I think for patients that have got other disorders such as Asperger's, it really helps them focus and concentrate on their breathing rather than being distracted by other aspects. So I do think it gives them a bit more feedback for breathing techniques, so it helps them.
So our patient with Asperger's syndrome was concentrated on physiotherapy. There were no problem with that. And there is another problem. He's very closed. He can't open to easy work with other person. We were afraid about the cooperation because of that. He's not I need the word. He's not a person who is rebellious, and he always very try to perform our instructions, but he has difficulties with opening for news, for new things. He's very afraid.
In our center, we have two teenage patients with Asperger's, and they're also not very happy with therapy that involves touching. Barbara knows both of them. What is your opinion to this point?
I can definitely imagine that especially these kind of patients like the Simeox therapy, because they feel the effect without anyone touching them and coming too close. And they also like, they prefer clear, if you tell them, devices, if you don't ask them too often to feel, but just to do, they prefer that. But I do have another question. You also mentioned that this patient has an anxiety disorder, and did the Simeox therapy not produce more anxiety because it feels like suctioning?
No, we haven't a problem with that. His anxiety disorder is connected with compulsive obsessive disorder, and there is a problem with the sputum, with the expectoration is unpleasant for that patient. And maybe it was a reason that previous he expectorate poor.
Yeah, that too I can imagine. And there's another point of interest that I would discuss. What are your possibilities of doing home treatment with Simeox? Do you have a device that you can provide the patient with at home, or do you have to prescribe a single device for each and every patient for him or her to keep?
We have 4 devices in our department, but we haven't give them to our patient home. We have some patients that they have Simeox at home, but they bought it themselves.
Okay. What are your possibilities in the UK?
So currently we only have 1 Simeox device. So we have to prioritise who is using it. And quite often the patients don't want to give it back after they've had it. It's hard to say, well, we need it for another patient. We did have 2 over the COVID period. We did have 2, and that worked a lot better because we had one as for the inpatients or outpatient clinic, and one for patients to use at home. So we will be looking at buying another one, hopefully.
Yeah, we were quite lucky because we found a sponsor, a company who's provided us with 5 devices, and one is staying in the clinic for inpatients, and we have a very strict nurse in the outpatient department who has got a list, and we try to rent it to patients, especially for those who are undergoing IV therapy. And of course, we do prefer ambulatory IV therapies, but it's not always that easy. And you have presented your patients. Some of them definitely need to stay in the hospital to have the right benefit from therapy. So another point is that I want to discuss is the assessment of efficacy. We've shown some values that can help, and I have seen the MFES 25 to 75 to be quite a good parameter to check during Simeox treatment.
Yeah, that's the one that we found has got the biggest increase when we've used the Simeox and compared to using airway clearance devices. Although your FEV1 and your FVC do come up anyway, I think when you have an IV therapy, you would expect them to come up. It's just really interesting that your FEF 25-75 does as well, proving that we are getting to those smaller airways and unblocking them as such.
I think, Philip, what would be good is to do maybe do the same in a non-IV patients and see how much it improves on their FE 25 to 75, because some of the improvements could be just the antibiotics and the aggressive treatment that we're giving when they're having exacerbation. But it'll be interesting to see as a research to see when you use it without IVs, how much improvement is coming up, maybe correlating with an LCI if you have an LCI in the department.
Yeah. Yes, that would be good endpoints for a study project. And I think Laurent is taking notes. Another thing is stabilization of the good effects of the IV therapy once the patients continue to use Simeox. Did you see this too? In the Polish presentation, it was very clear the FEV curve stayed up.
That patient didn't continue to use Simeox at home. No, it was just this device was used just during exacerbation.
Okay. All right.
Great. Thanks, Dr. Utz. We have 2 questions from the audience. First one comes from Australia, so welcome. They have not yet used Simeox, and they ask if when the patients use Simeox, do they breathe with a certain breathing pattern? For instance, autogenic drainage breathing at different lung volumes, or thoracic expansion breathing, or diaphragmatic breathing?
What I really like about the Simeox device is that you don't need a specific breathing technique. You should only quote teach the patient to really relax, to sit in an optimal breathing position. And they all know the diaphragmatic breathing, but they should be able to breathe relaxed and easily. That's what I like about using the Simeox device.
Right, thank you. Is there any benefit to use Simeox in alternate side lying when the patient is very hyperinflated?
So it's just like any other device, any of your PEP or acapella or anything, you can do it in any position, which is really, really, really good. I tend to start off in relaxed sitting, just to make patients comfortable with it, but I've certainly used it in alternate side lying and in prone as well to help with airway clearance.
I like to use it in different positions, especially with younger children. It keeps their attention better, and if they stay in one position for a longer time, maybe 3 cycles times 10 breaths, they forget about breathing properly, and so I really prefer to change positions. I even tried to mobilize them a little more, but as soon as you put the patient in a not very comfortable, relaxed position, the cough reflex starts too early. It comes too early, so it needs to be really comfortable.
And I have some information to the second question. How do we manage infection control when the device is used between patients? Of course, maybe someone asking that don't know that there are tubes and fields which are for one patient, and it then protects them against infection between them. And we sometimes, to check the device, we take some samples from the device and take them for culture, and there is no contamination with imported pathogens.
Thank you.
And of course, the important thing, the patient during physiotherapy didn't inhale the air in from the device, of course.
Yeah, good point.
Okay, great. So it's time to conclude. So, the speakers have discussed about very, very interesting topics. We can summarize some of them. So Simeox therapy could be a very good alternative of airway clearance therapy even in very difficult and challenging patients like teenagers. Simeox seems to be efficient, not only on the increase of sputum volume, but also on other criteria like thoracic expansion, improvement of spirometry data. Simeox can be used also very efficiently in combination with other therapy, other airway clearance therapy, chest physiotherapy, but also with calf trio. We had a very nice feedback in patients with very challenging compliance and poor engagement, despite these constraints, Simeox can be handled very well in difficult patients, and patients find the therapy quite comfortable after a short training. Very nice discussion. I would like to thank a lot all the speakers today for their amazing presentation. I hope you all enjoyed the presentation and discussion. And I inform you that a second roundtable will take place next week on Tuesday, and the third one on Thursday. And I hope we will join to this meeting for discussing different topics. So thank you everybody. Have a good day, and see you very soon.